Good morning, my dear beloved students. I am Dr. Shazia, Assistant Professor Pathology. Welcome to Pathology Lecture class. Today our topic is inflammation. These are important topics for third year, fourth year, even fifth year examination, and very important for written and viva examination. So let's start. First, what is inflammation or define inflammation? It is a response of vascularized tissue to infections and damaged tissue that brings cells and molecules of host defense from the circulation to the sites where they are needed in order to eliminate the offending agent. It is a large definition and you should memorize part by part. First important word is response of vascularized tissue. For what? For infections and damaged tissue. Then what will be happen? That brings cells and molecules of host defense from the circulation to the sites where they are needed in order to eliminate the offending agent. And last important word is eliminate the offending agent. So it is a response of vascularized tissue to infections and damaged tissue. Inflammatory response consists of two main components: vascular response or vascular reaction, cellular response or cellular reaction. Many tissues and cells are involved in these reactions, including fluid and plasma protein, circulating cells, that is neutrophil, lymphocyte, macrophage, plasma cells, blood vessels, cellular, extracellular constituents of connective tissue, and all are involved in inflammatory process. This is a figure and that shows the component of inflammatory response. This is a blood vessels and it is lined by endothelial cells, and this endothelial plays an important role in inflammation, and this is basement membrane and this is smooth muscle, and outside the blood vessel this is extracellular space and extracellular connective tissue that contain mast cells, fibroblast, macrophage, and monocyte inside the circulation is called monocyte, and when it recruited in the extracellular space, it is called tissue macrophage. And these are the extracellular matrix and also play important role in adhesion, transmigration, chemotaxis. And these are the component of inflammatory response. This connective tissue, blood vessels, and most important endothelium, smooth muscles, and extracellular matrix. Now, very important sequence of events in an inflammatory reaction is like a story or journey of neutrophil from blood vessel to the site of injury. It's a very interesting sequence of inflammatory reactions. The typical inflammatory reactions develops through a series of sequential steps. The first important steps is the offending agent, which is located in the extravascular tissue and recognized by host cell and molecules. This is blood vessels and this is extracellular space, and the offending agent, that is bacteria, virus, are located outside the blood vessel or extracellular space, and these are recognized by macrophage and other cells. This is the first sequence of inflammation. Then, leukocytes and proteins are recruited from the circulation to the site where the offending agent is located. And neutrophil and plasma protein, which are reside inside the blood vessels, are recruited from the blood vessel to the site of injury. This is the second steps of inflammatory reaction. And third, the leukocytes and protein are activated and work together to destroy and eliminate the offending substance. They work in the extracellular space. The inflammatory cells and plasma protein work together to eliminate the offending agent. And then reaction is controlled and terminated and damaged tissue is repaired. This is the final steps. The damaged tissue is prepared for healing and repair. It's like a story. Suppose you took street food last night and took lots of bacteria with the street food, and this bacteria reside in the extracellular space. And first steps of inflammation is recognition. recognition of this bacteria by macrophage or neutrophil. This is the first steps. Second steps is the inflammatory cell which are reside in the blood vessel are recruited from the circulation to the site of microbes or offending agents. Then third steps is this neutrophil and plasma protein are activated and work together to eliminate this offending agent. And fourth steps is elimination of the bacteria and chemical mediators, and inflammation is eliminated. And final steps, these injury is begin to repair and healing processes start. And these are the all about journey of neutrophil or sequence of inflammatory reaction. First, recognition, then recruitment of the inflammatory cells, then activation of these cells and mediators, and eliminate the offending agent, then termination of the neutrophil, and then mediators of inflammation are terminated, and final steps is ready for healing and repair. This is the sequence of events and inflammatory reaction as a short. Now we will discuss elaborately of this sequence of inflammation. Now important question, what are the cardinal features of acute inflammation? Cardinal features is an important Viva question. Cardinal features, that is rubor means redness, calor means heat, tumor means swelling, dolor means pain, and functionalacia means loss of function. All are introduced by a scientist named Celsus, except punctualacia, which is introduced by Barkov. This is a Barkov. These are the cardinal signs. Rubor. Rubor means this is redness. Rubor. Tumor or swelling. That is swelling. Rubor tumor. Calor or heat production. And dolor means pains. And this combination of rubor, tumor, calor, dolor cause punctualacia or loss of functions. This rubor or redness is caused due to vasodilation or enlargement of the blood vessel. This is the first steps of acute inflammation. And swelling or tumor is caused by increased vascular permeability or leakage. And calories produce or heat production due to rapid inflow of relatively warm blood through the circulation. And pain is caused due to tissue tensions and various types of chemical mediators, mainly bradykinin, serotonin, etc. The combination of rubor, tumor, calor, dolor cause loss of function or punctualacia. These are the cardinal signs. Now, rubor or redness is caused by vasodilation. This is the first steps of first response of acute inflammation. Tumor swelling mainly results from accumulation of fluid exudates due to increased vascular permeability, and calor or heat due to rapid inflow of relatively warm blood through the dilated or enlarged blood vessels in the inflamed area. And dolor or pain results from distension of the tissue. Other factors such as bradykinin, histamine, and other metabolites. The effect of tissue tension on the nerve ending due to tissue expansion, and acid of pH of the exudate, potassium ion, presence of serotonin and bradykinin. Dolor is the main features of inflammation. We always complain, doctor, to the pain in the site of the injury or inflammation. Pain is the main features. And combination of is rubor, tumor, calor, dolor cause loss of function due to combination of redness, swelling, heat and pain or punctuation. So what are the cardinal signs? Rubor, redness, tumor, swelling, calor means heat, and dolor means pains. And combination of rubor, tumor, calor, dolor cause loss of function. These are the cardinal signs of inflammation. Now, what are the advantages of inflammation? Sometimes examiner asks a question, justify inflammation, or what are the advantages or disadvantages of inflammation? The first advantage of inflammation is localize and isolate the injured tissue. That is, there is a demarcation between healthy and unhealthy tissue. The first important advantage is localize and isolate the injured tissue. The second advantage is neutralize and inactive the toxic substance that are produced during inflammatory process, that is neutralize or inactivate toxin like exotoxin, endotoxin, various enzymes, and these neutralize and inactivate by the inflammation. Third advantage is destroy or limit the growth of infecting microorganisms. A very important advantage. Destroy or limit the growth of infecting microorganisms. And final advantage, this is the most important advantage, prepare the area for wound healing and repair. So what are the advantages? First advantage is localize and isolate the injured tissue and demarcation the area between healthy and unhealthy area. Second advantage, neutralize and inactivate the toxic substance. And third, destroy or limit the growth of infecting microorganisms, that's bacteria, virus, fungus. And final advantage, prepare the area for wound healing and repair. Now, what are the disadvantages of inflammation? There are various types of disadvantages. First disadvantage is inflammatory reactions, for example, underlying life-threatening hypersensitivity reaction for insects, bites, drugs, toxin, as well as some chronic diseases of modern times such as rheumatoid arthritis and atherosclerosis. So first disadvantage is life-threatening hypersensitivity reactions. The second disadvantage is repair by fibrosis in healing process may lead to disfiguring scars or fibrous bands that cause intestinal obstruction or limit the mobility of the joint. That is complications of healing. That is repair by fibrosis may lead to disfiguring scar. And third disadvantage is pain. Pain and swelling leads to varying degree of disability. Pain is the main complaint always in inflammation. Pain and swelling leads to varying degree of disability. And third, fourth advantage may lead to rupture of the viscous or serious hemorrhage. Example of rupture viscous is important example is rupture burst appendix and the complication of acute appendicitis, rupture of the viscous or serious hemorrhage. And third and last disadvantage, propagate further inflammation. So what are the disadvantages? First disadvantage is life-threatening hypersensitivity reaction. For what? Insects, bites, drugs, toxins, and some disease like rheumatoid arthritis and atherosclerosis. Second, repair by fibrosis is the complication of healing repair may lead to disfiguring scars or fibrous band that cause intestinal obstruction or limit the mobility of the joints. And pain swelling may lead to disability and rupture viscous or may complication may be serious hemorrhage. Now, what are the types of inflammation? On the basis of duration, acute inflammation, which is short duration, and chronic inflammation, it is prolonged duration. Acute inflammation may be few hours, days, or chronic inflammation may be hours, days, or even months, years. So, what are the types? Acute inflammation and chronic inflammation. And acute inflammatory cells, mainly neutrophils, sometimes eosinophil, and chronic inflammatory cells are lymphocyte, macrophage, plasma cell, etc. Now, nomenclature. By putting itis to the name of the site is the nomenclature of inflammation, putting itis, suffix itis to the end of the organ. Exception, pneumonia, boil, abscess, keratitis. Here are some example of nomenclature. Inflammation in tissue or organ is designed by attached suffix itis to the affected tissue or organ. That is appendix. Inflammation means appendicitis. Inflammation of tonsil causes tonsillitis. Inflammation of thyroid called thyroiditis. Inflammation of bronchi, bronchitis. Inflammation of myocardium, myocarditis. Inflammation of colon means colitis. Inflammation of urinary bladder means cystitis. Inflammation of liver means hepatitis. Inflammation of the skin means dermatitis. Inflammation of the testes means orchitis. Inflammation of the breast means mastitis. Inflammation of the ovary means oophouritis. Inflammation of the stomach means gastritis. Inflammation of the joint is arthritis. Inflammation of the nasal cavity is rhinitis. And inflammation of the brain, encephalitis. Inflammation of the meninges, meningitis. Inflammation of the small intestine, enteritis. Inflammation of the gallbladder, that is cholecystitis. Inflammation of the bone marrow, osteomyelitis. These are the important terms you should remember always. These are the important for clinical side, basic subject examination. You should memorize this itis or nomenclature. And lung inflammation means pneumonia. Pleural inflammation means pleurisy. These are the nomenclature of inflammation. Now, acute inflammation. Our main topic is acute inflammation. It is relatively short duration, lasting for minutes, several hours, or few days, and is characterized by exudation of fluid and plasma protein and immigration of leukocytes, predominantly neutrophil. These are the main words: exudation of fluid and plasma protein and immigration of leukocytes. These are the main words: exudation and immigration. These are the main features of acute inflammation: exudation of fluid and plasma protein from blood vessel to the circulation, from blood vessel to the extracellular space, and immigration of leukocytes, predominantly neutrophil, to the site of injury. These are the main features. Acute inflammation is the initial rapid response to injurious agent. Initial rapid response to injurious or damaged tissue that serves to deliver mediators of host defense, that is leukocyte and plasma protein, to the site of injury. This is the main function, that is deliver mediators of host defense. Deliver mediators of host defense, that is leukocyte and plasma protein, from the blood vessel to the site of injury. These are the main words. Deliver mediators of host defense, that is leukocytes and plasma protein, to the site of injury. And main characteristic points is exudation of fluid and plasma protein from circulation to the extracellular space and immigration of leukocytes, predominantly neutrophil, to the site of injury. These are the main features of acute inflammation. Now, acute inflammation has three main components: alteration in the caliber of the blood vessels, that is vasodilation, and structural change in the microvasculature, that is increased vascular permeability and immigration of leukocytes from the microcirculation. Very, very important, written on Viva question. What are the components of acute inflammation? Three important components: alteration in the caliber of the blood vessels, that is vasodilation; structural change in the microvasculature, that is increased vascular permeability or vascular leakage, and immigration of leukocytes from the circulation. These are the normal figure of blood vessels. This is the arterial end, and this is the venous end, and these are the extracellular matrix, and the inflammatory cells are reside inside the blood vessels. And what will happen in inflammation? The vascular change, that is vasodilation. This is the normal blood vessel, and this is the inflamed blood vessel. That is vasodilation means increased vascular blood vessels are dilated or enlarged in size. These are the arterial dilation and venous dilation. This is normal blood vessels, and this is inflamed blood vessel, that is dilated, vasodilation. And second is increased vascular permeability. Increased vascular permeability. And increased vascular permeability leads to leakage of plasma protein and plasma, which cause edema. There is these plasma protein and plasma reside inside the blood vessels and leakage through the endothelial gaps and leads to formation of edema. And third, an increased addition to the white cells. And third, cellular events is recruitment and activation of neutrophil and monocyte from the blood vessel to the site of injury. These are the events. This is normal blood vessels, and this is inflamed blood vessels. First component is vasodilation, that is arterial and venous and dilated, expansion of the capillary bed, and leakage of the plasma protein and plasma and neutrophil immigration. This is the inflamed blood vessels. Dilatation, increased vascular permeability, and immigration of leukocytes from inside to outside. This is the normal blood vessels, and this is inflamed blood vessels. This is dilated, expanded blood vessels and increased blood flow. This is the these are the component of acute inflammation or vascular change and cellular event. Vascular event means vasodilation, increased vascular permeability, and cellular event means recruitment and activation of neutrophils and monocytes. These are the major components of acute inflammation. Now, important question, what is exudation? And exudation is formed due to leakage of plasma and protein from blood vessel to the extracellular space. Exudation means escape of fluid, proteins and blood cells from the vascular system in the interstitial tissue or body cavities. That is, escape of fluid, proteins and blood cells from the vascular system into the interstitial tissue or body cavities known as exudation. And what is exudate? Exudate, three, you should memorize 3E. Exudate, extravasated, extravascular. Exudate means extravasated, extravascular inflammatory fluid, which is rich in protein, has much cellular debris, and has a specific gravity more than 1.020. It implies significant alteration in the normal permeability of the small blood vessels in the area of injury. That is, exudate means extravasated extravascular inflammatory fluid, EEE. Extravasated extravascular inflammatory fluid, which is rich in protein, has much cellular debris and specific gravity more than 1.020, and it implies significant alteration in the normal permeability of the blood vessel, that is increased vascular permeability or cause vascular leakage. This is the normal blood vessels and hydrostatic pressure which occurs from inside to outside, and colloidoscopic pressure from outside to inside, and plasma protein which are reside inside the blood vessels. So these are the endothelia. And in case of transudation or transudate, increased hydrostatic pressure from inside to outside may be due to venous outflow obstruction, that is, example is congestive heart failure. Transudation, increased hydrostatic pressure from inside to outside due to venous outflow obstruction, example congestive heart failure. Or decreased colloidal osmotic pressure due to decreased protein synthesis, that is liver disease, or increased protein loss, it is kidney disease, nephrotic syndrome. These are the mechanism of transudate or transudation, increase hydrostatic pressure and decrease colloidal osmotic pressure. Hydrostatic pressure from inside to outside and colloidal osmotic pressure from outside to inside. And in case of exudation or exudate, high protein content and may contain many white cell and dead cells are immigration occur. Due to vascular leakage, vasodilation occur, increased vascular permeability, which cause increased interendothelial space, and these are the space between two endothelial cells and formation of endothelial gaps, and through this gap, plasma and plasma protein and inflammatory cells leakage occur. May they comes out from blood vessel to the extracellular space and cause formation of edema due to increased interendothelial space or increased vascular permeability, plasma protein and plasma and inflammatory cell comes out through this leakage and cause edema formation. Normally, plasma and protein are reside inside the blood vessel. In case in inflammatory condition, vascular leakage or increased vascular permeability occur, and the protein and cells are comes out through this space or interendothelial space or gap, endothelial gap, and which cause edema formation. This is a clear fluid, this transudate, and hazy inflammatory fluid, this is exudate. This is a very important figure. Transudate is always clear, crystal clear, and exudate always hazy and contains cellular debris and much protein content. This is exudate and this is transudate. Now, what is transudate? Transudate is a fluid which has low protein content and specific gravity below 1.010, occurs due to increased hydrostatic pressure to the vascular compartment. Increased hydrostatic pressure and low protein content. This is the important word. Increased hydrostatic pressure and low protein content and low specific gravity. And it is essentially an ultrafiltrate of blood plasma result from osmotic and or hydrostatic imbalance. That is, osmotic and hydrostatic imbalance means increased hydrostatic pressure and decreased osmotic pressure across the wall, vessel wall without vascular increase in vascular permeability. Here vascular permeability is normal. Here main problem is osmotic and hydrostatic pressure. Alteration of osmotic and hydrostatic pressure. That is hydrostatic pressure increase and osmotic pressure, colloidal osmotic pressure is decreased, which cause transudation or formation of transudate. You should remember low protein, low specific gravity, increased hydrostatic pressure. So what are the advantage of exudate? First advantage, it dilutes the irritants and lowers its effects. First advantage is dilution, the irritates and lower its effect. It brings natural and immune defensive substance and lactic acid formation by polymorphs. It's a bactericidal agent and it lowers the pH. So it inhibits bacterial growth. It's an important advantage. Lactic acid formation by polymorphs and is a bactericidal agent and it lowers the pH and inhibits bacterial growth. And it dilutes the irritant, lowers its effects. And exudate contains fibrin, important content, which has three functions. It forms a union between severe tissue. This acts as a bridge uh, that forms a barrier against bacterial invasion and its phagocytosis. The exudate contain important substance fibrin. It forms a union between severe tissue and forms barrier against bacterial invasion and is phagocytosis. Is important MCQ question. Now, what are the disadvantages of exudate? It acts as a splendid medium for bacterial growth. It helps in bactericidal agent, but it also acts as a splendid medium for bacterial growth. An excess of fibrin may lead to production of potassium ion and presence of chemical mediators like prostaglandin, serotonin, bradykinin cause irritation of the nerve ending, result in pain. That is, excess fibrin may cause pain by production of potassium ion, prostaglandin, serotonin and bradykinin that cause irritation of the nerve ending and tissue tension occur which also press the nerve ending and result in pain. Now, what are the difference between exudate and transudate? This is an important written question. Also, Viva question. Difference between exudate and transudate. First difference is protein content. We know that exudates has a high protein content, more than 3 gram per deciliter, and transudate is less than 1 gram per deciliter low protein content. And distribution of protein as in plasma in exudates and nearly all albumins in transudate. And fibrinogen present in exudates and absent in transudate. And specific gravity high in exudates due to protein more than 1.20 and specific gravity low in transudate due to low protein content less than 1010 12. And exudate contain plenty inflammatory cells, mainly neutrophil and neutrophil debris, and transudate contain few inflammatory cells. And causes of exudate is increased vascular permeability or vascular leakage, and cause of transudate is hydrostatic imbalance. It is increased hydrostatic pressure, decreased colloidal osmotic pressure across the vascular endothelium. And exudate always in inflammatory condition and transudate is a non-inflammatory condition. More important example are congestive cardiac failure, cirrhosis of the liver and constrictive pericarditis. These CCC are the common cause of transudate. Congestive cardiac failure, constrictive pericarditis and cirrhosis of the liver are the cause of transudate. And exudate always inflammatory condition. Now, what are the stimuli for acute inflammation or what are the causes of acute inflammation? May be triggered by a variety of stimuli. That is most important, infections and microbial toxins, trauma, tissue injury, physical and chemical agent, tissue necrosis from any cause, foreign bodies and immune reaction. These are the important, very important for fiber and written. What are the causes or stimuli for acute inflammation? That is, first important cause is infection and microbial toxins. Second, trauma, that physical or chemical agent, maybe extreme temperature, maybe excess of oxygen, always excessive oxygen may also cause tissue damage and tissue injury, and which leads to inflammation, tissue necrosis, foreign body, and immune reaction, that is hypersensitivity reaction. Now, the characteristic reaction of acute inflammation, that is vascular event or vascular change, cellular events or cellular change. Cellular events contain leukocyte extravasation and phagocytosis. And leukocyte extravasation means journey of neutrophil from the circulation to the site of injury. This is called extravasation. And phagocytosis, it is vascular event or vascular change, cellular event and cellular change. These two events are very important for Viva as well as written. Vascular change and cellular change. Vascular change. Vascular phenomenon plays a major role in acute inflammation because the main mechanism of host defense against microbes, antibodies, and leukocytes are normally carried in the bloodstream. So, vascular change is very important because the main mechanism of host defense against microbes, antibodies, and leukocytes are normally carried in the bloodstream or they reside in the blood vessels. This is the normal blood vessels. There is no net outflow increase and inflow decrease, and this balanced by increased net outflow and decreased net inflow, and ultimately no net flow, and capillaries are not dilated. This is arterial end and this is venous end. And what will happen in acute inflammation? Net outflow is increased and net outflow increase, and ultimately net outflow, and there is escape of plasma, protein, and inflammatory cells from blood vessel to the outside due to increased hydrostatic pressure and colloidosmotic pressure. And these are the normal blood vessels, which is normal, and in inflamed blood vessel it is dilated and there is an increased net outflow, and net outflow increase and leakage of plasma protein and inflammatory cells and plasma from blood vessel to the outside. Now, changes in the vascular flow and caliber. And we will discuss the vascular event in next class. So, I want to repeat the topics what I have discussed today. And next class I will discuss about vascular event and cellular event. So, first we have learned inflammation definition. Define inflammation. It is a response of vascular tissue to infections and damaged tissue that brings cells and molecules of host defense from the circulation to the sites where they are needed in order to eliminate the offending agents. And two response, vascular response and cellular response, and these are the component of acute inflammation, and these are the sequence of inflammatory reaction and journey of neutrophil from blood vessel to the site of injury, and these are the cardinal signs of acute inflammation. There is rubor, tumor, calor, dolor, and loss of function. And we have discussed about advantage and disadvantage and nomenclature of inflammation. And last, we have discussed component of acute inflammation and exudate transudate. And next class, I will discuss elaborately about vascular event and cellular events. So, Allah Hafiz, stay blessed. See you soon, inshallah. Yes.